Welcome everybody to the Depths of Motherhood podcast. This is a special season dedicated to the tribe of the mother, but also I know any mothers listening will find this extremely valuable. I've created each episode to offer simple, digestible, and supportive information, which I hope will educate and inspire anyone who listens. So this is by popular demand. Please help us to educate and support the tribe holding the mother. Look forward to passionate and highly knowledgeable guests dedicated to reclaiming the essence of birth and embracing conscious parenting. Throughout our time together, our guests will serve as the guiding voices, illuminating the path towards a deeper understanding of preconception, pregnancy, birth, and postpartum. This is with the mother and the baby being the center of the exploration. In the show notes, you'll discover the link to Nourished Mother package, which will offer many different resources to complement each episode. This is free for all members in the Women's Circle, or £33 for everybody who just wants to purchase the package. A heartfelt thank you to our incredible guests and immense gratitude to my partner for supporting me on this creation. And finally, last but not least, special thank you to Araya, my daughter, for being the endless well of inspiration. Welcome back, everybody. Thank you so much for being here. Before we get into this episode, I'd like to take this opportunity to ask you a question. We are moving on to season 8 very, very soon. And I'm wondering if there is anyone that you would like me to invite on this show. And also, is there any areas that you would like to go into? Because over the past few years, we've been circulating through preconception, conception, pregnancy, postpartum. Now, I am feeling as we move into season 8 that we get into the depths a little bit more storytelling through any phase of motherhood. These questions, challenges, wins that we all have in our life experience, bringing more of that into the show. So if you could pause for one moment and ask your body, what is it that would support me in my life right now, in the moments where I just want to put something in my ear to either give me inspiration or to help me feel like I'm around my sisters, my family as I tune into a conversation, or maybe it's a personal question or challenge that you would love to ask an expert about. I'd love to hear from you. You can comment underneath this episode or reach out to me on the Depths of Motherhood or Women's Circle online. Now, in today's conversation, we are joined by the brilliant Ellen Heed, a somatic educator, sexological body worker, and the creator of STREAM certification, which is a comprehensive approach to the remedial care of scar tissue and also holistic care for the pelvis. Ellen's work stands at the crossroads of science, somatic, and spirit. Drawing from Eastern and Western traditions, she guides clients and practitioners alike to listen to the body as a living, intelligent map of healing. In today's conversation, we explore scar tissue not only as the afterthought, but as a pillar of health. We speak about the physical and emotional impact of trauma and how episiotomies and other interventions are often followed by little to no aftercare. We go into caring for scars and exploring the 12 weeks following wound care. We then move into sexuality and intimacy. And this question is close to my heart and many of you who are listening who are asking the question, how long should we wait after giving birth before we have sex? And the response goes through many different threads, one of which is how media and pornography can shape and distort our connection to our own bodies and sexuality, and how curiosity, awareness, and informed touch can begin to shift this. This ties into the importance of understanding cervical scar tissue, especially in the context of birth control, postpartum recovery, and embodiment after medical interventions. And we touch on the role of the vagus nerve, which is something you've probably heard of. It's been very, very popular on social media over the past few years. And she shares some information that I didn't know myself. And it was about the uniqueness of the vagus nerve and how it travels differently through each body. And as we pull this all together, we can really see that no human being fits inside of a box. We all have our own unique history, our own unique beliefs and experiences. So when we start to care for people through this lens, we can start to support this integrated whole person healing and care. So if you are a practitioner looking to deepen your offerings, Ellen Stream certification may be for you. It's designed for those who want to deliver effective, compassionate care that address the root causes of physical and emotional pain, especially when it comes to pelvic health and trauma. I've left the link to this course in the show notes. If you're looking for a space to join other women, to sit, to meditate, to take a moment in time to come back to the body, to feel, to listen to story medicine, then we have monthly live gatherings that you can join. It's free or by donation. All right, let's bring it in. Take a deep breath, and with each breath, gently say to yourself, call in my energy home. Breathe it in. Feel your body receive this life force down to your fingers and your toes, and let yourself experience this wholeness. One more deep breath together, exhaling to soften in this space. Thank you so much for being here to receive this conversation with Ellen Heed and I.
All right. Thank you so much for being here with us all today. I know that there's going to be many people really excited to hear what you've got to say on the questions that we are going to be exploring. But before we get into that, I would love to know how you got into doing this work, because I know that it's very much about our innate wisdom to be able to heal once we can tune into that. So how do you share that in your own words, what you do?
Well, I tell people that scars are meant to heal. If we couldn't heal our scars, we wouldn't have survived this long as a species. We sometimes need help to identify the scars. And in a culture where the needs of people with vulvas for vulva care are routinely overlooked, nobody was talking about scar tissue. And I had a colleague who approached me about scars after birth. I was a body worker. That's how I got into scar tissue. I was in the garment business for many years and then burned out and decided I wanted to do something more meaningful than put clothes on bodies. I wanted to work with the health in the body. And so I became a yoga teacher and a body worker. I had an exceptionally brilliant teacher who taught me pillars of health, 4 pillars of health: biochemistry, biomechanics, emotion, and scar tissue. Scar tissue is a pillar of health. Whoa, who thinks about that? Nobody. Nobody puts scars up at a level equal to, as important as what you eat, whether you stretch, what's going on in your emotional being. Scar tissue is equally important. So that was my education. Scar tissue is equally important. It can, pardon my French, it can fuck you up just as certainly as any of the other pillars. And so we were taught, when you see an appendectomy scar, you could see a scar that's an inch and a half long, but you have to visualize the grapefruit size fibrosis underneath the scar that then radiates out to something that's the size of a cantaloupe, to a watermelon, in terms of its long-term effects and the distance it can crawl along the connective tissue matrix inside the body. Scars are made of connective tissue, and a scar is a more dense form of connective tissue. And when connective tissue gets too dense, it surrounds our nerves, it surrounds our blood vessels, it surrounds our veins, it surrounds our lymphatics. And so when that connective tissue gets dense, it starts to interfere with the fluid dynamics of the body. And we are nothing if not beings whose health relies on good flow of fluids. You got to get blood to the cell with the oxygen. You got to get the blood taken away from the cell to go back to the heart to pick up more oxygen. So that's the circulatory system. The lymph is the garbage collection system of the entire body. And if the lymph can't move because it's choked by a scar, then those toxins sit around in the extracellular matrix, the goop around the cells. and it accumulates. Think of an estuary. All of the places where land and sea meet are full of fluid. That fluid is clean, then we have a healthy ecosystem. When the fluid is full of the accumulation of toxins, species start to do what? They mutate. What happens in our body when we have a lot of toxins stuck in our extracellular matrix? Cellular mutation, not always for the best. So that's how I learned about the bigger, broader, deeper implications of scar tissue. It's super important. And so that in mind, I thought, well, I'm 40, I'm changing my career. I better select a really specialized niche. My teacher said, scar tissue in the pelvic floor. You know what? Nobody's doing that. You could do that. You have you're a person with a vulva, you're female, you can go forth and conquer. I'm like, yeah, I asked it to me and to go forth and conquer scars in the pelvic floor.
And you are doing such a great job. This is the one of the reasons that you came here to share this information because like what you're saying is so true and it wakes up so much inside of me. I remember I was a nurse. I was a nurse for many years and I worked on different wards, but in the surgical ward, I was always really confused why they would go down for surgery and I would be dressing the wound, but there wouldn't be any care to support them in any of what you were talking about, supporting this blood flow, supporting just the movement so that there can be this fresh, nourishing blood and energy to the space. And also it can remove as well. And then when I gave birth, I tore because the hands of the doctor was pushing down on my vagina and it
Oh,
tore.
oh, yeah. Oh,
Yeah, it was a nice experience. And it was a very deep and almost to my anus tear.
yes. Yes.
And I didn't, the stuff that you were talking about, woof, I wish I knew this then because I kind of went on a journey myself and it was through, I was doing steams, yoni steams, but that also what was the thing that really got me into my body was I started to look. Took a mirror and I looked and I
Beautiful.
started to gently touch just around my thighs to feel because I just didn't want to close off from my body. I knew the first time I looked, I was like, holy shit, like what is going on down there?
Oh, a lot of people don't have the courage to look and won't. That's what happens is they basically go, something bad happened and I just can't bear to go back to the memory that that scar represents. It was too traumatizing and I don't have the courage. It fails me. Plus, I don't look to look at my parts anyway because I think my labia is too big or my pubic hair is too long or, there's a discoloration here or look, oh, there's a mole. I'm not perfect. So I don't even want to know. I don't want to look. So we have this crazy idea of what vulvas are supposed to look like in our heads from pornography largely. But who tells people that half of the people in pornography have had their labial lips surgically shifted? So what we're seeing has no bearing on actual biologic reality. And the truth is, vulvas have as much variation as snowflakes.
Mm,
Every
I
snowflake is
love
different.
that.
Every vulva is different. Every labial length, every labial color, every amount of pubic hair and how curly it is or whatever it is. It's all different, different. It's different as our eyes, as different as our skin tone, as different as our whole physiology. It's just as individual. But we have this idea of conformity and we'll do anything to conform because the amount of pressure on people with vulvas as being something shameful or something dirty or something, our ignorance is deeply reinforced.
Mm,
And it's amazing to be saying this in 2024. I was saying this in 2014. I was saying this in 2004.
mm,
I started teaching anatomy classes for people with vulvas at yoga studios because I was hired to teach anatomy for yoga teacher trainings. I'm like, all right, I'll teach this. I'll teach your yoga teacher training. And I want you to let me teach about genital and pelvic floor anatomy because no one's talking about this. And where are people going to get into their bodies except for yoga studios? So they need to occupy their whole body. And there's a lot in yoga, by the way, that is very anti genital aliveness. There's postures in yoga where you firmly place your heel in your perineum to cut off the nerve supply. And that's for people with penises. So they will get over their sexual desire because there's this proscription around desire and a normal expression of sexuality that was embedded in the Indian culture. And so there's a lot of inherited ignorance around our pelvic floor, and it's time to change that. And I'm glad there's as much awareness being brought to this subject of scars in the pelvic floor. This is why I'm on a campaign to really shift our awareness, but it's not just scars, it's vulva health in general. And it's not just women, it's all people with vulvas. I call it the vulvist movement. You know, we need a vulvist movement because it goes hand in hand with this idea that unpaid labor for people with vulvas is how society works. The assumption that we're there to bear children, and they don't call it labor by accident.
Mm.
But who gets compensated for that kind of labor?
Oh my gosh, this is getting goosebumps. This conversation is incredible already. There's two, I have these questions, right? But let me just bring this up as it's coming through. Because as you're talking, I was brought to a memory of my cousin who was actually older than me. But when she was 8 years old, she had surgery to remove what they said was excess of her inner labia. They cut it off so that she would look, okay, I'm doing a funny
Normal.
easier. Yeah, normal.
Yeah.
And then it also made me think about, my partner, they cut off his foreskin. And that's something that we have big conversations about. And I'm really just like pulling this into how does the scar tissue, how does
Yes.
it affect us on all levels? Because then we have like perineal tears, we have like episiotomies, C-sections, like how.
All the things. Yes, that's right. We are routinely disturbed in the continuity of our connective tissue through all these surgical procedures, whether they're cosmetic, birth related, or for some other reason, like a fibroid surgery or endometriosis, look-see surgeries, because the only way you can actually confirm an endometriosis diagnosis is to open up the body and look. It doesn't show up on a scan. So you have to actually have the surgery to go in with cameras or do an open abdomen procedure, which is less common. Mostly it's arthroscopic these days, but nonetheless, surgery is surgery. The evidence, the data suggests that arthroscopic surgery causes just as much disturbance in terms of scar formation in the long run. In longitudinal studies where they follow populations for 15, 18 years post surgery, there's no difference between an open and closed abdominal procedure in terms of scars. And the havoc they wreak in terms of ultimately producing something like abdominal obstruction. You could start with a C section, or you could start with some other kind of abdominal procedure like a gallbladder removal or an appendectomy and end up with abdominal obstruction as scars close off the food tube, which is a common cause of death in people who are 80. That is related. And that's what they were called the scar studies in Scotland, in hospitals in starting in the 90s and going through the mid-aughts. And they followed people longitudinally, huge populations, in the tens of thousands of people to see what happened with all of those abdominal and reproductive surgeries from hysterectomies to C-sections. And they found that there was a huge occurrence of downstream problems and that scars actually did affect our long-term health outlook. So yeah, scars are a big deal.
And I'm curious with what you've seen with scars. Like I know you focus on the pelvis, but as you mentioned before, it connects to every part of the body. What about like, say if somebody has their tonsils removed, like my niece has just had her tonsils removed, and then there's this connection with the throat pelvis, or the whole body. But like, how can bringing that in, plus everything we spoke about around scars around the pelvis area and the abdominal area, any part of the body, how can we begin to hold space for that and nourish this healing journey, support the body on its healing journey?
Well, the key word is inflammation.
Mm.
We need to have a direct relationship with inflammation. There's 4 causes of inflammation from my perspective: biochemistry, biomechanics, emotions, and scars. There's an amazing study done about emotion and scar tissue where they induced a burn on couples who were known to bicker, and they sent them home to bicker. And the people who bickered the most took the longest to heal.
Why?
They actually, inflammatory cytokines can be triggered by the cascade of emotions that happen when we get upset. So we have to start with a sense of safety, number one. We need to feel safe because that promotes a healing environment inside of our body. If we don't feel safe, it does the opposite. It promotes an inflammatory environment in our body. So inflammation causes the body to literally produce the kinds of collagen to wall off the inflammation that's known as a scar. There's 28 potential species of collagen in our bodies. Some of them make thicker, denser, more tougher kinds of collagen. Those tougher kinds of collagen, if they overaccumulate or they never stop proliferating, we end up walling off whole organ systems. A kidney infection, getting an organ removed is a large insult to the whole innate intelligence of our body, but sometimes it's necessary if you have cancer in that organ and it saves your life. That could be an important decision to make. If somebody has their tonsils removed, what do you do? How come those tonsils got so inflamed in the first place? That's my question. What's going on with the biome, the microbiome that lines the throat? What's going on with the microbiome in the food tube? What's going in the microbiome that inhabits our whole vulva? And because it's populated, let's be honest, those bacteria are marching from the anus into the vulva and into the bladder. And sometimes they cause a chronic infective situation that ends up creating chronic bladder infections, interstitial cystitis. There's such a deep relationship, even biochemistry. When I say that, I mean our microbiome. What's going on in our microbiome that can be fixed? And a lot of people are eating in ways that promote opportunistic overgrowth in their microbiome.
This is fascinating, honestly, and it makes perfect sense. So let's just think about someone who has a tear or they've had an episiotomy and they've come home and they don't know where to begin. They know that they want to hold space for this. They know that they want to support their body through healing. But what are some ways just to begin that? Because I think it can be
Sure.
very overwhelming to come home and be
Well,
like,
it's very confusing, and there's some rules here.
"Hmm,
So the wound healing is part of something called the inflammation cascade, the inflammatory cascade. You don't want to interrupt the inflammatory cascade when you're trying to close a tear or an episiotomy or a C-section scar. So I use a lot of castor oil in my practice. Castor oil is vastly anti-inflammatory. That's one of the reasons it works. It also improves lymphatic circulation and drainage of the wound site. But the body has its own intelligence, and you don't want to interrupt that intelligence. For at least 12 weeks, you need 12 weeks post surgery or post tearing before you would even think about castor oil. You need 12 weeks for organs to find their more natural alignment. People call me at 6 weeks in a panic. Oh, I've got prolapse. Oh my God. I'm like, I don't want to talk to you for another 6 weeks. Then we'll talk and we'll discuss, because you want to leave the body to its innate intelligence for healing. And then if you feel that the scar is still problematic, or that the prolapse is still happening, or that you're still in pain, or there's an infection or a complication, at 12 weeks, that's when you start to do self-care. So first of all, wait 12 weeks before you look. You need to get all the information. If you're not feeling it, wait 12 weeks. Then take a look and see what's happening. And if things are still not looking the way you think they should, it's time to seek some help. Seeking help from a stream practitioner or a sexological body worker or a physical therapist or even a more enlightened gynecologist around things just ain't right there. What can I do? What we can do to help ourselves is apply castor oil. So we can apply it just topically. You put some castor oil on your fingers, you rub it on the place where the incision has healed. 9 times out of 10, that will take care of most of the problem. If there's swelling, it will help the swelling. If there's thickness or hardness in the incision, it will help it to soften. If there's pain, you have to go inside the vagina, because that tear started in the vagina and moved outward. So there's often scar tissue inside the vaginal floor. You can certainly apply castor oil there, but it's not an everyday thing. If you're applying castor oil inside your vagina, you do it 1 day out of 3. Because if you do it every day, you can sensitize to the castor oil, which can cause itching and burning. And that's more inflammation. So the thing that heals you could also promote inflammation if you do it too often. So it's about how much is enough and how frequently is enough. It could be once every 3 days for a period of 8 or 9 weeks, but your tissue will change. And if you can't reach in your own body, there's castor oil soaked tampons, or you go to somebody who can reach, who knows what to do. Midwives can help with this. People have scar tissue on their cervix. The morning after pill causes scar tissue in the Oz of the cervix and is deeply connected with failure to progress in birth. Who knew that? You know who found out? A midwife who's a strange student who was looking for scars and going, how come? She just started asking questions of her patients who were having precipitous labor and then failure to progress. And she said, and one of them said, I took the morning after pill 3 times in 4 years, or I took it like candy. And these were the people who were having this issue. And then she figured out how to go in and massage the cervix to open up the scar. And then, 2 hours later, the baby is born. So this is something people do not know. She wrote a book. Her name is Rowan Two Sisters, and the name of her book is Cervical Scar Tissue, A Bigger Deal Than You Think. It's available on Amazon.
That's great. Stay as it is.
That's right. Exactly. Say what you mean. She's good at that.
Oh, that is one that I'm going to have to pick up because that is fascinating. And like, how would
Isn't
we
it?
have found out other than being curious and being able to meet different cervix, different, from all around the world with all that journey and put some clues together? That is incredible. Whoa.
Yeah, amazing. Amazing what we don't know. The willful ignorance around our sexual function is deeply ingrained in our culture. And I'm not saying the people with vulvas are willfully ignorant. I'm saying the availability of information has been deeply limited by a desire to keep people ignorant
Mm.
because that's how you keep them disempowered.
Yes, yes, yes. And oh my gosh, like it just ties in so closely to our relationship with our sexuality as well and our relationships, how this can all ripple out, if that doesn't feel good before. And I feel like there is this pressure to bounce back or just like get back to the way you were, which will never happen.
You don't go back to being a maiden. Once you cross the line from maiden to mother or parent, however you identify your role, it's not, there is no turning back. And people don't want to admit that. It's sort of like, oh, that means I think it's a very existential question. What is my identity now? And how does it change from being pre pre-birth giver to post-birth giver? Post-birth giver is a state of being that needs to be explored and explained. And people are trying. Kimberly Johnson wrote her book, The Fourth Trimester, and it's a good book, but there's so much more. It doesn't really explore deeply enough the existential question of what changes when we give birth in terms of our identity. She made a stab at it, but I think we know more now about that.
Yeah, the more that there is this opening to explore and to see that there is a different way of going over this bridge and existing, then also there's more feedback that we're given. And I feel like for families as well. Well, I'll just speak for myself, but I knew I had to take time. I knew I needed to be patient and to rest. But at the back of my mind, I so I believe so deeply that I needed to start to have sex again, or it was going to ruin my relationship, which is so funny because I hardly have sex
Can you
now.
say enmeshment? Can you say codependence? Can you say we commodify our sexuality in order to mollify our partner's grouchiness or something like that? Because it will calm them down. But
Mhm.
why don't we talk about the effects of testosterone in the body and self-pleasure and sexual autonomy? How come that's not part of our conversation? I am not here for your convenience when you feel uncomfortable around a need to ejaculate.
Mhm.
Wow. I mean, we get enrolled so easily into thinking that this is our duty.
Yes.
Duty? It's something we give freely because we want to, but if we don't want to, we need to have the courage to say, not tonight, I don't like it. Or maybe you could improve your skills and understand it takes a full 45 minutes for full arousal to occur. Let's have that discussion, shall we?
Yes, exactly. And these conversations are much needed, like you said, for recovering and healing together if there's someone else with you for them to understand it. I really wanted this season to be so that everyone could be listening together so that they can understand like what is happening physiologically, emotionally, spiritually in these times, and that there is this connection between everyone involved. And if there can be this greater understanding, then people can kind of find their own way down this path because there's no like set way to do it. We're kind of just remembering how to listen to our body again, how to have our boundaries, or just to say like, I feel like this right now, like this is how maybe you could consider taking care of yourselves. And it's like taking care of ourselves and also appreciating the other person and keeping that connection that way. Like it doesn't just mean sex is the only way to connect, but I feel like that has been pushed through the media and the films. Like, this is what romance and relationships mean. So, what are the
There's
ways?
nothing romantic about what you see in pornography. Nothing. Where is the romance there? It's zero. It's about appealing to people's dopamine circuitry, and there's nothing wrong with that. That serves a function, but we have to be realistic about the function it's serving. It's the fastest route to get off. That is not romance. Romance has to do with intimacy, vulnerability, safety, acknowledgement, and the amount of time it takes for the 5 erectile tissue beds in the pelvic floor of a person with a vulva to fully engorge so that deep lubrication is possible, so sex feels good. Let's talk about that,
Yeah.
because that's not what you see in pornography. What you see in pornography is people getting fluffed beforehand, both male and female, or people with penises, people with vulvas, depending on how you spin it. But they're getting fluffed. That means they've got somebody there to do the arousal for them before the cameras even get rolling.
Right.
Nobody talks about that. Seeing is believing in our nervous system. And so we see banging away and some woman screaming
Mhm.
in fake ecstasy, and it is not real. Or if it is real, there's been a good hour of foreplay beforehand for it to be real.
Yeah.
Deep, rapid banging penetration can feel amazing if you're engorged enough. That kind of engorgement takes 45 minutes. And people don't.
45 minutes, y'all.
I know, I'm just saying, because I keep hammering this because nobody spends that kind of time. Therefore, they never understand what that level of arousal even feels like.
Mm.
There's a
So,
level of lubrication that happens at that point that most people have never felt, that comes out of the Bartholin gland, that's delivered to the deep vagina. And it's thicker, it's slipperier, it's your own self made super lube. And most people don't even know they come equipped. They think they need lube, 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 and more lube. No, they need more arousal before, before challenging that mucosal tissue with friction.
mm. And then we can just get into like, so if there has been trauma to the body, if there's a scar tissue, and if there's an association with the experience being traumatic, and the emotions come through with that, and then coming to merge with another human being or even yourself, and the feeling of just not being able to connect to the body, I feel like that is such a practice of being able to come back and feel everything again, because that is like, phew, as the memories come in, it can be like you're in and out of your body all the time. That's what I experienced. I was like, okay, I'm like getting nice and sexy with my partner. My body is softening. Then I'd be like, memory of a man with a plastic glove putting his hand inside my vagina. It's like,
Right, right, exactly. So we need to integrate those memories. We need to see them for what they are, which means we're actually working on them with somebody who can hold that space. So that when we attach a new meaning to those memories, he was doing the job he was trained to do, he was doing his best. He's not trying to hurt me, but he is ignorant. He's ignorant of my needs for safety. He's ignorant of, in his training, of being told, see, I'm going to put my hand in now. The lube is going to be cold. Are you ready? Are you ready? Who asks that question? Do I have your consent? Who asks that question? You're hearing it more frequently since the work of Betty Martin and this thing we call consent culture now. It's in our awareness and it's beginning to be a part of medical training, but for so long it was not. And we're enculturated. Our mothers, our grandmothers, their mothers were never asked, "Are you ready?" They were just basically either drugged into a twilight sleep
Mm.
or just never acknowledged that they had a right to feeling ready for anything.
And I can also say when I was in the hospital, we did get taught consent, but it was in this way, I'm just going to do this. I'm just going to give you an injection. And if I would have sat and looked and understood more deeply, it would have made more sense. But like at the time, I was just following the lead, and I was always wondering, why does it not feel right? I was questioning what is wrong, and sometimes it's just like doesn't click because it's so deeply ingrained to treat someone like that. And it made me feel so much guilt. And then I had to process that and be like, I was literally doing what I thought was right. And yes, it's such a shame that I couldn't see through that to look someone in the eye and be like, hey, like, this is what I would like to do. How do you feel about this? And also the time frame. It's like there's so many factors. But I love what you just said of like taking the experience as it when it comes into the mind or when it moves through the body and being able to see the other perspective, almost like the ignorance that comes from that, and that they were doing what they were taught to do, and
Yes,
they didn't take your needs, your safety needs into account, and that's not right. And that's what happened. Like,
that's right. That's not right. And that's what happened. But coming to that in terms of acceptance, they were doing the best they could under the circumstances. We need to change the circumstances. That's what he said.
yeah,
That's why I'm on a crusade, so to speak, for this idea of vulvism, because vulvism is the primacy of the nervous system and our autonomic nervous system to feel safe before we engage anywhere on or near the vulva.
mm,
Wow, what a concept.
right. Because isn't the cervix deeply connected, like the end point to the vagus nerve?
Yes, that's correct. There is a paper published that says that the vagus nerve, I mean, it's not a lot. It's controversial whether the vagus nerve deeply innervates the cervix. But there's some anatomy papers that have been published that says you can trace it that way. The vagus nerve is very slippery. I have to give a shout out to Gil Headley here because I just attended his nerve tour where he's literally mapping the vagus nerve throughout the body. He spent a year in the dissection lab during COVID mapping the vagus and the entire nervous system, but especially, and they found out that the vagus is not purely parasympathetic. It's got sympathetic fibers and it's trading places. Everyone's vagus is individual to them. So we
Mhm.
can't be too can't paint with too broad of a brush around what we believe to be true about the vagus nerve. This gross oversimplification. It's deeply complex and different person to person. However, that being said, our need for safety and our connection to our dorsal vagal and our ventral vagal, they're not different nerves, they're different termini in the brainstem. People think there's a dorsal vagal nerve. No, there's a dorsal vagal terminus in the brainstem. There's a ventral vagal terminus. There is a vagus nerve that comes down from the brain. There's not two of them. People have this idea, oh, old vagus, new vagus. It's not the nerve, it's the place it plugs in into
Wow.
our brain. That's different. So let's have an actual considered conversation. I mean, I'm an anatomy nerd. This is what turns me on. This is how I spend my spare time researching this stuff. But what I wanted to say about Gil is that he's done these elaborate and beautiful and deeply respectful holistic dissections of our genitalia for penises and for vulvas. Not intersex yet. He hasn't found an intersex cadaver in which to do this so far, but I know he will because he thinks that way. He thinks deeply holistically. What I saw when it took me 15 years to screw up the courage to watch a clitoral dissection. I didn't think I could bear it, but I did watch it and I saw that all of the tissue beds in our pelvic floor are all the erectile tissue beds are connected. It's all one large unit. It's not vestibular bulbs and the perineal sponge and the clitoral legs and the clitoral shaft. And yes, they have distinct terminal branches, but in the middle, above the perineal body, which is why episiotomies are such a big deal, that's the locus and the central processing where all of these erectile tissue beds come together as one unit.
Wow.
And that's why I'm motivated to keep talking about scars in the pelvic floor, because once those erectile tissue beds are scarred, then engorgement cannot happen in the same way. You can correct that through the use of castor oil and massage and normalize that tissue. But if engorgement isn't happening, lubrication isn't happening. If lubrication isn't happening, sex is painful.
Wow. Thank you so much for this work that you're doing. I mean, what comes to mind is like how I was taught anatomy is like put things into boxes and kind of everything's disconnected. Like you're looking at a car or something and then this connects to this. And but this very separate. And it wasn't so much about, like learning how they're all so woven together, like you're talking about. And I think because it seems more complicated. So the work that you're doing of going into that you can use your words to communicate what is actually happening in the body is going to make such a big difference to being with ourselves more holistically because we can't pick one piece off. It's just like,
Thank you. Exactly. That's the whole point. Holistic inclusion, not materialist reductionism. We need to stop reducing things and compartmentalizing. We need to see how we are whole beings and how that connectivity within our connective tissue matrix works in conjunction with an erectile tissue bed. Connective tissue is sentient from my perspective. That means it's conscious. When you cut through any place on the body, the whole connective tissue matrix responds. It's an organ of communication. I'll say that because I believe it, because I see miracles of healing that could only be true if the connective tissue was sentient.
Yeah, my gosh, it's so beautiful. Oh, I got goosebumps. So we could talk forever, ever, but I just want to pull out some things because through the conversation, like we just kind of rounded it up then, is we can't just put things into boxes and everybody is so unique. And the way that you describe the vagus nerve moving through the body for that specific body because of the past experiences and because of what's perceived from the outside as safe or not safe. I'm so curious about that, by the way. I'm going to completely dive into that. But just this knowing that we are so unique, but when we come back into our body and we start to listen without any expectations, because I feel like expectations can come from the conditioned beliefs around us.
Yes, I agree with you. Complete conditioning
Yeah.
creates our expectations.
Right. What if we just listen and said, hey, how does this feel? And also become educated. So the education plus then being with our body and listening. And then like having this as a practice with our partners as well is such a beautiful thing. And I can feel that I've learned so much through this conversation that they could never be a step by step because it is just such a beautiful dance. But there's
And
been
it's individual, right?
individual, but there's
Yeah.
a how to move forward.
Well, here's the thing. Education is the first step to safety. Let's start there. We need to be educated. So there are books. There are beautiful books written about female ejaculation in the G spot by Deborah Sundahl, Women's Anatomy of Arousal by Sherry Winston. These are books that people are easily available that people can use to educate themselves about the function of their parts and to understand the diversity of conformation as normal instead of abnormal. And that will take care of a big piece of safety if people don't feel insecure about the way they look. It's normal. Variation is normal.
Yeah.
And all of the vulva books, ones that show the variations, and books about penises, cut and uncut, the variations of normal. We are deeply individual in our body conformation, and that's to be celebrated. That needs to shift in our consciousness, this notion of conformity. But I think that's very much driven by social media, which is very much driven by people's need to belong, which is very much driven by capitalism's need to keep consumers insecure, so they'll keep spending.
Honestly, you just nailed it there. Seriously. This is
We
a
need to
big
get some of these
conversation.
issues.
In this house right now, we are like really dissecting our life and looking at when we see on social media posts, what is it really telling us or what is it trying to sell, really? And that is just, oof, it's this whole awakening. And I feel that we can do that through getting to know our body because it has taken over how we feel about our existence in this world and
That's
how
right.
it looks, like you mentioned. So, yeah, education, because once we understand the different variations and know that they exist, then we can be so much more forgiving to ourselves and be curious. And I just think
Curious, you said it. That is the magic word, curiosity. Bring our curiosity. Our curiosity is one of our most precious gifts. With our big fat human brains, it comes deep curiosity. I mean, animals are deeply curious too. It can tell, watch any kitten play, that's doing it for curiosity, right? And instinct. But curiosity must lead instead of fear and a need to conform.
yeah,
How does this difference fascinate me?
just,
What can I learn that's special about this difference? What does this difference enable in terms of sensation?
yeah. And be ready to find out that some things that you thought was true might not be.
Absolutely.
So I'd love
Absolutely.
to know where the listeners can find you and what you have to offer, if you have the offerings online.
I teach a 2-year certification program. Well, it varies I teach health coaches, body workers, and pelvic care specialists, and I offer certifications in those 3 things. My program is like a series of nested Russian dolls. There's a health coach certification at a year and a half of study. And if you keep going, then you can get a bodywork certification. And if you keep going after that, you can get a pelvic care certification. That's the structure of what I'm teaching. And it's called STREAM. That stands for Scar Tissue Remediation, Education, and Management. But we're not just talking about physical scars in the body. We're also talking about the unseen scars in our psyche due to our conditioning. And we need to look at that and we need to resolve it before we are able to hold space for people with trauma in their pelvic floor. 'Cause it's a lot because it's systemic for all the reasons we've been talking about. And I find that when I focus solely on pelvic trauma, because I treat all kinds of things, treat and work with all kinds of issues, everything from a stiff neck to, somebody's got double vision because they've got uh, glued up fascia on the side of their head. I'm a cranial sacral therapist. I do shiatsu. I do deep tissue, and I do scar tissue remediation. So I work with my hands for all kinds of physical issues when I see clients. But I'm much more interested in the education. But if I'm only working with pelvic trauma, it's easy to get overwhelmed. So we need to be able to resource ourselves. And a lot of the training is based in how do we develop techniques and self-with-self practices so we can stay resourced no matter what walks into our treatment room or who walks in to our treatment room. Because sometimes it's not just the person, it's their whole lineage that's coming to visit. And they're not real happy about us interrupting their conditioning.
Yeah, it's exactly. They all kind of get in there, don't they?
Yeah, they do.
Well, that sounds absolutely amazing. And thank you so much for the work that you're doing and having this incredible conversation today. Thank you. Thank you.
Oh, what a pleasure. Very pleasure. Much pleasure to be here.